Now, moving on from talks regarding ways to retain the processes to how to correctly manage the processes, I'll hand over to Mr. Sachin Gupta to talk about ocular prosthesis.
Yeah, good afternoon, everybody. I will be talking on ocular prosthesis. Somehow this is not working. Excuse me. The finishing touch. I have no financial interest from this presentation. I will be covering these topics based on the indication for ocular prosthesis. The first indication is thisis bulbi. Probably this is the favorite case for ocularists because we can provide good results in these cases. Patient gets best movement in thisical eye, and these cases are less manipulated by surgery. And even we can fit a prosthesis where there is a clear cornea. We can create a corneal vault behind the prosthesis, and we can do fenestration for better tear exchange. And such patient also get a good prosthesis even without the surgery. The next is anophthalmic cases, post-enucleation or evisceration, where implant is must, and it's very important. So from ocularist point of view, when we are creating a prosthetic eye, we need at least 2.5 milliliter volume to make a 3D prosthetic eye, where we can have anterior chamber in the prosthetic eye. So the remaining 4 to 4.5 milliliter volume should be augmented by the implant, and if we convert this according to the implant diameter, so in our perspective, 20 mm implant is a good size to create a 3D prosthetic eye. Implant size is very important. If it is oversized, then we have to create a very thin prosthesis, and which can cause rotation in the prosthesis. It can rotate clockwise or anti-clockwise, which is a problem. Then we have to compromise with anterior chamber depth in the prosthesis. Sometimes there is an upper lid retraction because of the oversize of implant. If the implant is undersized, then it can cause enophthalmos or post-enucleation socket syndrome. The prosthesis will be thick and bulky, and movement of prosthesis will be restricted. So if you see this case, this patient had an implant of 22 millimeter size. If you see this result, here the upper lid, there is a retraction of upper lid. This prosthetic eye looks little bigger than the fellow eye. Conformer is very important after the surgery. Appropriate size of conformer is must. So when on table, when you are putting a conformer, the largest size conformer is better, but it should be easily moved horizontally and vertically inside the socket. In case of tarsorrhaphy, if you are planning to do a tarsorrhaphy post-surgery, at least it should be removed 1 week prior to the prosthesis fitting, because it can compromise the fitting of prosthesis. And painted conformer is a good option, which can be advised after 1 week of the surgery. Instead of transparent conformer, patient get a painted conformer. So this is an example. This patient, she got a painted conformer after 7 days of surgery for the healing period. And we had 4 holes in this painted conformer for better tear exchange and eye drops installation. So this gives instant cosmetic rehabilitation post-surgery. The third indication is congenital disorders like microphthalmos, where we put expanding conformer. We prefer to put a custom conformer from day one because impression gives us the exact idea of space and dimension of the socket. We can use this information and we can uniformly expand the socket. Stock conformers in early age may cause uncontrolled expansion, so we do not prefer a stock conformer for expansion. Custom conformer can help in expanding horizontal fissure light, which is very important in expansion from day one. So these are the stock conformers. And then we have pebble-shaped conformer, which is made after taking the impression. And now, from 2018 onwards, we have the conformer which has a wedge on anterior surface. So why we have wedge, sorry. So I'll explain. When we take impression, we convert this impression to a conformer. But sometimes, in some cases, this conformer rotates clockwise or anti-clockwise. So what happens? The conformer which we want, it should stay like this. But when it rotates, so it gives under expansion at the desired area and over expansion where we don't want. So these wedge implants helps in it prevents the rotation, and it also helps in horizontal expansion. We have controlled horizontal expansion through this wedge. So this was the case which was treated with the wedge-shaped conformer. So coming to the prosthetic contact lens and prosthetic shell, prosthetic contact lenses are indicated for discolored eye, not for the disfigured eye. And prosthetic contact lens cannot correct enophthalmos, squint, or any discoloration of the sclera. It is only for the cornea. So this is a case where a contact lens was given to the patient, but this was replaced with the thin scleral shell. We have next case, orbital prosthesis, where silicone prosthesis, which is adhesive mounted or spectacle mounted, are given to the patients. Silicone prosthesis, which is adhesive mounted, is directly attached to the face. And then we have recently developed a prosthesis which is called digital spectacle orbital prosthesis, which is created by taking digital picture of the patient's other eye. So I'll explain, like we have taken a good quality picture of the patient's other eye. We use it like with the help of software. We flip it, we take print with different brightness. And this print is varnished to protect it from UV light. And then this is laminated with heat cure acrylic so that we can prevent from the water also. So I'll just skip the video. I'll show the direct result. This was a digital spectacle prosthesis. This prosthesis can be given in any given case. Like here, she had a complete ptosis, and her daughter was getting married after 1 week, so she was looking for an instant cosmetic rehabilitation. This case, she got the prosthesis post mucormycosis. In this patient got prosthesis for severe contracted socket, again for mucormycosis. About the care and maintenance, the prosthesis should be removed as per the convenience of the patient. If it is comfortable, patient should not remove the prosthesis. External factors like dust, dryness, humidity, AC vents, these are the factors which cause dryness in the prosthetic eye, and patient can clean it after 4 to 6 weeks. But if they feel that it should be clean after 1 or 2 weeks, they can clean it. It can be cleaned with mild shampoo like baby shampoo and water, because we just need the surfactant. We don't need chemical to clean the prosthetic eye. Custom prosthesis can be soaked in RGP solution if it is required and cleaned with the water. There is a 3-phase model for prosthetic eye wear. When we put a prosthetic eye, what happens, then there is a mucus substrate distributed over the prosthetic eye, and then we have equilibrium phase, which it lasts from 4 to 8 weeks, where there are a lot of deposits covers the prosthetic eye, and it helps the socket to adopt the prosthesis. But then we have a breakdown phase where there is a lot of deposit over the prosthetic eye, and which can cause calcification over the prosthetic eye and the protein deposit, which can lead to GPC. What is the next level? I will explain. There are a few recent advancements. Digital printing of iris, where we take the digital print of the natural eye, and it is used to make the prosthetic eye. Next is 3D printing of eye, where the iris can be scanned and it can be 3D printed and it can be used in the prosthetic eye, which we have already started using. Just few seconds. Hydrophilic artificial eye. Artificial eyes are made by such material which is hydrophilic, which is not water loving, but we can create a hydrophilic artificial eye now. Thank you.
Thank you so much, Mrs. Sachin. I think no matter how many surgeries we do, without your support, I think our